jointly.
Like,
Yeah,
that would be
exactly.
nice.
Yeah.
So,
Wow.
so
Yeah.
this is like,
So
That's what
I'll
counts.
do some research on that.
It's gonna be
For December 31st.
and then they don't say that. Well, I'll have a word.
Yes.
We're gonna have a big
I don't care if it's sanctioned or not.
and we're gonna tell dirty
Watershed.
jokes. And we're gonna be completely inappropriate.
Yeah, he can sell them. I know they're
So this will
More than usual.
company.
December
But
31st.
I'm not familiar with them. I gotta check that out.
Or listening. Or
Programs
before.
are there
Or before.
We have no volunteer interviews today.
together would be the way
Yeah.
to go.
All right, I'm going to call the meeting to order. We're going to start with Pledge Allegiance.
Volunteer interview.
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay. We'll start with the consent agenda.
There isn't?
No, they moved it back.
Oh, all right.
Check.
All right, I'm out of touch. Oh, which is not a surprise.
Is this something new?
All right, approve the minutes of January 18th. Approve local road improvement program grant agreement. Approve funding agreement with DNR for the Lake Zumbro docks. Award contract for the Justice Center remodel general construction package. Award contract for Justice Center remodel electrical package. And award contract for the Justice Center remodel mechanical package. Accept the Minnesota Department of Health's Youth E-Cigarette Prevention and Cessation Initiative Grant. Approve 2022 Health, Housing, and Human Services Purchases of Services Agreement. Award contract for the Government Center and Annex Scheme Replacement, General Construction Project, and Mechanical Project Package, and Electrical Package. Approve gambling permit for Lake Zumbro Forever. An award for contract 2022 127 Boiler 3 Tube Assemblies.
Motion to approve.
Second.
All in favor?
Aye.
Any opposed? Carries. All right, now to our regular agenda. Discussion decision items. Award the sales tax or sales of taxable general obligation crossover refunding bonds series 2022A.
I like the way you run a meeting, Mark, so far.
I
trained you well.
All right, Wilfredo,
For questions.
I believe, right?
So, good morning, commissioners. Can you hear me okay?
Hear him.
Kinda.
We're gonna turn it
Kinda.
on for a moment.
Who's speaking?
Should be Wilfredo.
Yeah, it's Wilfredo. Good morning.
Morton.
Okay, so hopefully you can hear me okay now?
Yeah, we can't see you, but we can hear you.
Okay, hold on. Sorry about that.
There he
There
is.
you
about
go. Yes.
Perfect. So, the action here is to authorize the issuance and award of our sale of the taxable general obligation crossover refunding bonds, Series 2022A, to Raymond James and Associates. They offered the lowest cost of financing for the bonds out of 10 bids received. Just in summary, let me share the screen here so at least you can see it. Okay, so as you can see, the par amount of the bonds is about 26.5 million. We have a significant amount of savings, about almost 2 million, $1,955,646, while preserving the original structure of the old bonds, which is a maturity date of 2036. So our average annual debt service savings will be around 177,554. And as you can see here, the net present value of those savings is about 6.16%. And just so you can notice here at the top, the old bonds were about 4%. The new bonds average interest rate is about 2.32%.
That's great.
So I think that's kind of the summary of the sale of the bonds. So if you have specific questions, we also have representatives for Northland Securities, both Tammy Omdahl and George Eilerson available, just in case you have any questions.
Hey, are there any questions?
Motion to approve.
Okay,
Second.
motion a second. All in favor? Aye. Opposed? Carries. Thank you.
Yeah, just a quick comment relative to anybody that, I'm sure there's cast of thousands listening to the county board meeting.
Just saved them $2 million.
We have done this many times over the course of my 20-year career on the board, and it should be noted that our finance people and everybody looking at this has saved the constituents and potential increases in property tax of millions and millions of dollars, not to be minimized. And this is another $2 million that goes in the bank for that. So applause for Wilfredo and his team to continually look at this, investigate, and do it. And so 2.3% money is pretty cheap money. We probably should have borrowed some more. Never mind.
That's interesting.
All right, thanks, Mr. Chair.
All right, no, thank you. All right, next up, COVID update.
COVID's still around.
Megan says no.
Megan says,
Good morning. Good morning, Chairman of the Board, Commissioners. Yes, COVID is still around. Megan and I are back to give a quick update. Like we normally do, Megan will give the epi update, and then I will wrap it up at the end with just different things that are on the horizon for us. So Megan, if you want to go ahead.
Yeah. Good morning, Commissioners. And yes, unfortunately, COVID is still around. It's still, but I guess I could say I'm coming with you with not terrible news like I usually come with you. So we'll go with that. So first of all, like we always do, just want to provide a situational update of what we're seeing in the United States and Minnesota. So the good news is with the Minnesota graph, what we're seeing from the New York Times, we are definitely starting to see that kind of that roller coaster coming down. We do see it falling rapidly across the country. However, hospitalizations remain near peak levels and deaths are rising. But again, as we know, hospitalizations and deaths usually come after those peaks. So right now, the United States has seen around 2,500 deaths announced almost every day, and that continues to grow. And like I said, we're starting to see higher levels of hospitalizations. In Minnesota, we also have some positive, hopeful news that at least according to Dr. Osterholm and some wastewater data, they seem to think, at least in the Twin Cities, that they have peaked around earlier last week. I know Mayo Clinic also believes that we probably have, for Olmsted County overall, have probably peaked as well. I think it's always really important though to say, like, especially here in Minnesota, we're still rapidly trying to play a little bit of catch up with some of our data. So we really won't know where we've had our peak until we're out of the peak, I guess is the best way to say it. So I think you know me, I like to have different visuals for you to kind of be able to depict the story of what we're seeing here in Minnesota. So this one comes from MDH, and they put this graphic in their weekly report. And really what I wanted to show here was just how fast Omicron did hit us and hit the state. So you can see the darker blue means the higher weekly case rate. So, and also to say, like, Olmsted County is not alone with what we're seeing. Currently, Olmsted County in the state of Minnesota has around the 5th highest incident rate, and Minnesota currently for the United States is in the top 5 as well. But again, we saw the Omicron come about 2 weeks later than some of the Northeast, so we're kind of fitting right along that timeline. All right, so let's talk about testing. And so again, I always have to give a huge shout out to our healthcare partners for keeping up on testing. I always just want to put this caveat here too, is we do not have a full handle of testing that's happening here in Olmsted County just because of the availability of at-home tests. On the week of the 18th, the federal government rolled out their at-home testing program where any address can apply for and get 4 free tests delivered. I think even my sister said she got notice that she should be getting hers this Thursday. So they are starting to kind of get out there into the community. You can see though too, we have our testing numbers that our healthcare partners have collected. You can see that they're starting to potentially see a drop off in testing as well, and not as high, but still going through and running almost 10,000 tests per week here in Olmsted County. Our positivity rate remains also extremely high. Right. So this is us looking at our epi curve. So this graph looks a little bit different because I wanted to give you all the most up-to-date information or look of where our case count is, because it is continuing to change on a daily basis, if we're being honest. Again, I also want to call out a couple of things that MDH has done a great job. I believe last time we came and spoke with you all, there was around 40,000 tests that hadn't been processed. They have worked extremely hard to start to bring that processing those cases down to around 7,000. I will say though, when we look at our own data, we're probably only seeing cases getting vetted to us via MDH, probably from January 25th or 26th. So what moral of the story is, for the last two bars, we expect those to continue to increase. So what you see is the week of the 2nd, we officially were over 3,500. The week of the 9th, we had hit our record level of around 3,650-ish or so. Currently, we're still under 3,000 for this past week, and then you can see where we are for this coming week as well. Again, we want to call out, we know this is an underrepresentation, and this is also where I want to say we won't know we're out of the peak until we're about a week or so out of it, just because of how case counts are coming in. So let's break down this graph a little bit. So this is looking at hospitalizations. So the shaded pink is at looking at our cases. So if you kind of want to look at that as like background, just to give you some context of what we're seeing. Then the dark line, red line, is our 7-day rolling average of ICUs. Talking with Matthew, our epidemiologist who also works on COVID, we were trying to figure out, probably looking at a 7-day average is going to take out some of the variability and some of the noise and give us a little bit of a better picture of what's going on with the hospitalizations. Because I will say our team here at Olmsted County are really starting to look at hospitalizations more as a true idea for us to understand COVID in our community, just because of those two caveats around testing and case and underreported case counts. So then the gray line is our non-ICU, and then the blue line is our 7-day average hospitalizations. So you can see back in 2020 into early 2021, that was our one of our highest peaks. During that time, we were seeing anywhere between a 7 to 10% hospitalization rate. Then you can see where we are now. We're experiencing maybe between a 2 to 5 hospitalization rate. However, just because of the sheer amount of cases here in Olmsted County, we are seeing those higher number of hospitalizations, but it could be much worse, I guess is the best way to say it. If we wanted to go back and see what we were experiencing at some of our highest levels. The other thing that we will start to look a lot more into and using kind of as another key metric for us is looking at deaths. So we posted, I believe, another death yesterday. So that brings us a total up to 152. Earlier this month, we passed the threshold of we've actually had more private residents die from COVID than our long-term care, which is hard to believe when you look at like December of 2020 and January of 2020 and even April of 2021, though it was so predominant in our long-term care facilities. All right, so let's talk a little bit about vaccinations. I wanted to show this graph so you all could see we are beating Cook County when we look at our eligible population at 92%. And then
yeah, we can't see the graphic, latest one.
Oh, sorry about that. Okay, so there's deaths. I apologize. Okay,
there we go.
So there we go. Thank you for calling that out. It moved on my screen, but so anyways, you can see that we are beating Cook County at 92% versus that 91. right now we have around 65% of our population that's eligible has received an additional dose. And our 5 to 11-year-olds have plateaued a little bit at 51%. So I know when Denise and Mike were presenting to a smaller group of you all had some questions around looking at our hospitalizations and vaccination status and versus not. And so I will say this is our kind of our happy medium. Even though I just said we are seeing our highest level of hospitalizations, that number is actually really somewhat hard for us to really interpret. So that's why we're looking to this state. So the other thing is too, is I know when you look at this graph, you're saying, well, Megan, that only goes through the end of December. Again, we're kind of on that lag period to really be able to see that wave. So you can see here, this is data for Minnesota. And you can see that the huge protective factor of being fully vaccinated versus not fully vaccinated when it looks at hospitalizations and deaths. The CDC also came out this past week with additional data around the efficacy around getting a third dose and preventing COVID-associated emergency department and urgent care encounters. So, and they were looking at for both Delta and for Omicron. So if we think about it, getting a booster prevented between 94 and 82% of associated emergency department encounters. And then from hospitalizations, it was right around 94% as well. So I guess the moral of the story is vaccines do work and boosters are extremely important, and it's not too late to get that. The other promising news of why we really want to encourage boosters as well is, like we've always expected, that new variants or new mutations have emerged, and so the new one that's making the rounds is actually a subset of Omicron. So the current one or current wave we're experiencing is really called BA1, and now they've identified BA2, and they've really seen that and been able to study this in Europe. But we're starting to see it here in the United States as well. So we do think that BA2 has higher transmissibility. However, there is in early studies, it shows that vaccines do continue to work against BA2 and potentially work even better against BA2 than BA1. So another reason, if you haven't gotten your additional dose, or if you're not up to date on your vaccine, your COVID vaccine, this is a good opportunity to do that. So again, just trying to paint a picture of we're studying the data, we're looking at it, and it's really just becoming more and more evident that vaccines do work, and especially preventing those hospitalizations and deaths. So I'm going to turn it over to Denise to just talk about some of our focus areas.
Good morning, commissioners. Yeah, just real quick, just to give you a sense of what we have coming in the next 2 weeks around our response efforts. We do continue with vaccine clinics. We just finished up another community booster clinic here at our public health building. This week, we will also be in Byron and Iota, helping out with those youth vaccines. And then we will also be at the Church of Nazarene helping with the Cambodian community as well. So some offsite there. Next week, we are working with Rochester Public Schools, and we'll be doing a round of first dose at Sunset Terrace and Ben Franklin. And then also we'll be back in Stewartville and continue to work with community partners around identifying where there is need with that. Like Megan said, working really hard to help for those people, one, whether they need a second dose, a booster, or those who have changed their mind. Or are now eligible and are looking to start their series. So trying to remain flexible there. As an FYI, you may have heard in the last 2 days, there is a likelihood that there will be authorization now to start the vaccine series for our 6-month to 4-year-olds. Just so you know, this is clearly a little bit different ball game with this young of kids. And so we would likely do this through our mainstream immunization clinic here on site at Public Health versus large mass clinics out in the public with that. Our medical partners will take the bulk of that group as well. A little bit with our joint communication efforts, knowing that we are hitting a bit of a plateau in that 5+ group. They're working on releasing a 5+ vaccine campaign, a media campaign. So should be seeing that in the coming days. Again, partnering with Mayo Clinic and some of our other community partners to push that out. Also, a huge shout out to our PAC team and the Joint Communications team and partners for pushing out the COVID community newsletter. Been getting a lot of positive feedback on that with up-to-date information there as well. And then lastly, in the same tone of just really, again, trying to help educate the public and help those who are still maybe on the fence or need more information, we do continue with outreach. This week, we are partnering with ACLA to do a town hall meeting with our Hispanic community as well. And then again, as those requests come in, we do our best to help accommodate and partner on those. Lastly, there's been a push. We received some KN95, so working on a plan to get those out to community partners as well, and also pushed out a couple hundred test kits to community partners as well, who maybe are in have more of a need and don't have the means necessarily to get to those on-site testing places. So we continue to monitor, plan, pivot, and adjust based on what's coming our way, but doing also a lot of planning about how we mainstream some of our services, including vaccine clinics, back into our normal clinical operations. So we are holding our breath, crossing our fingers, toes, standing on our hands, whatever it takes to hopefully get to a place where this becomes more of just a part of our normal operations. So any questions for Megan or I, comments?
A quick question. We are hearing across the state about our healthcare systems being completely overloaded and needing to have extra help. I'm not hearing any news accounts of that being in our an issue for our community, but I think particularly of maybe Olmsted Medical Center being a smaller organization with less, maybe as a result, less flexibility. I'm wondering if we have any concerns about capacity in our own community for the demands on the healthcare system.
Thanks, Commissioner Cascade. That's a great question. We actually meet weekly with our healthcare partners to talk about all kinds of things related to the response. I can tell you about a week or two ago, Mayo was in what they call red status. And so they were feeling strain, but keeping up. OMC also had been feeling the strain. They're seeing more of the cases around just our normal influenza-like illnesses in the community, but also feel like they are coming down from that as well. So as Megan said, more to come there. We stay in close communications as we see where these peak, right? The lagging is always, hospitalization and deaths, just to see that high peak of numbers that we saw of cases. We will continue to monitor that. But for now, Commissioner Cascaden, they seem to be holding their own.
Thank you.
You're welcome.
Any more questions? Thank you for the report, Megan and Denise.
Mr. Chair, I just think that, we are now at almost 2 years from the first case being diagnosed in Minnesota. I guess it's in March, but 2 years since this all began. And our staff, whether it's, our public health staff, our communication staff, our ADC staff, have just done an amazing job. And the strain of that, the strain of that on everyone, I think, is really significant. I know that Commissioner Podolsky recently posted a really telling little vignette on Facebook about how exhausted everyone is and how tired we are of this long pandemic and the long struggle on a personal basis. And yet those of us that don't have to face patients every day or do all the sanitizing of facilities, of all the management, it's just affected our personal lives. Maybe we don't like wearing a mask, but we have to, that kind of thing. But our staff have been on the front line now for 2 years with emergency preparedness, emergency response, vaccine clinics, tracking data, trying to communicate with the broader public, protecting the people who are in our facilities. And I just think they've done a fabulous job, and it's time for us again to say thank you. And it's very hard to know how to say thank you in a way that reaches all the many people who've been on the front lines, whether it's our first responders. It's just amazing what the community has done. And I just want to take a moment while these two folks, and when I see our sheriffs online listening in as well, just hats off to everyone for your ability to run this marathon and to stay focused on the work at hand, the normal work, as well as protecting us and responding and taking action when to reduce the impact of this infection on our community. I mean, the fact that we are #1 in the state on immunizations is fantastic. There's just lots of indicators that our professional staff have pulled together with our community partners and have done a wonderful job. And I just want to take a moment today during this meeting to say thank you. There's no way to really express the broader gratitude that the community should hold for you, but I just want to say thanks.
Very nice. Okay. Thanks again. We'll move on to board and committee reports. Matt?
Last Thursday was the Township Association, but not much.
Quiet, huh?
Pretty quiet. That's all I have mind.
Sheila?
There's some good news on the housing front. The Minnesota Housing Finance Agency, I don't imagine you're on their mailing list like I am, announced their awards of what they consider the 2021 grants. And we have 2 projects in Rochester, in Olmsted County, that have been funded. The first one is the Titan development that's out by Church of Hope on west on 2nd Street. That'll be affordable housing. The Titan bought land from Church of Hope and has now received the 9% tax credits that'll make that project go through. And then the other one is First Homes. First Homes received funding that allowed them to build row houses, and I think it's on 9th Street, just off of 9th Avenue, just off of 4th Street, an infill project, and that they've had to make a lot of modifications to meet the city's transit-oriented development plans. And it's going to be, I think it's 6 units and row houses, so it's a different approach to a little higher density, and they receive the funding that they will need to make that go forward. And then just generally, the Housing Coalition is had new members and is working to develop a work plan. The executive director of that project, Jeremy Emmy, went to work for the Rochester Fire Department. So we are at the place where David Dunn and Jen Woodford, the president of the Area Foundation, are serving as interim co-directors and working to try and accelerate the development of the projects that we authorized under the ARP funds and with the new funding that Mayo has to try and get that money out the door and get projects started, because it takes about 18 months from the time you have a project approved to even make it happen. And I've been pressing, let's get going, because we have some deadlines that we will have to meet with those ARP funds. So that's good news. And then final thing I'll call out is that maybe I should let Commissioner Wright tell you where we're going tomorrow.
Well,
One other thing. I won't be here at your next meeting because of the National Association of Counties Legislative Conference. I will be attending that. Go ahead. I'm sorry.
Yeah. Commissioner Cascade and I are attending a meeting on tribal relationships. And I think it's important for Olmsted County to be aware of these situations, because we have the Prairie Island community now as our neighbors in Olmsted County, and we're looking forward to having very good relationships with the Prairie Island community. And I think that learning more about the history of tribal relationships in the United States and in Minnesota will help us do that. That's it.
That's
No
it?
other report.
Okay, Stephanie?
Sure. I think everyone knows, but maybe the viewing people don't, that Olmsted County received a Circle of Excellence Award from the state for our work with streamlining how our clients can apply and be assessed. Did I cover it right, Travis? Yeah, it was I watched it on Teams or Zoom, and they were very impressed with what we've done here. I did want to say I've watched a couple of the Rochester League of Women listening sessions, and for the most part, there's never been, as far as I could tell, more than half a dozen people watching them or participating. So I don't know if that will pick up later, but at least we have offered that a lot of listening sessions to the public to participate. I just thought I'd let you know, Three Rivers, that I'm now on the board, could be an example of how some small agencies are really struggling with how to do this mask mandate and how to, what they should require of their employees and the clients who come into their offices. And that continues. The library board is in the middle of selecting a new director, as Audrey Betcher will be retiring soon. I also just wanted to check. It came up on my computer in one of those little dingy squares, and then that goes away really fast. Did the state acknowledge and recognize and decide to support something with our GAIN program? Did I see that or not?
I didn't see it.
Okay, it came and went so fast, and then there's no way for me to recall it. But I thought I saw that the state had recognized a housing initiative from Olmsted County. No? Okay. Well, it was a brief moment of pride, and maybe it'll come back up in the corner of our screens again. That's my report.
Okay, Jim?
No, nothing.
Yeah.
A couple of things that not worth mentioning. One that I think we should look for, and if Jennifer is listening also, I saw in the governor's supplemental budget direct payments for facing people, a lot of categories like healthcare workers and so on. What I neglected, if I looked very carefully at it, and they said emergency responders, I'm not sure what that category includes, but I certainly hope it includes cops. If somebody can follow up or just be aware and watch this as it evolves, given it makes it into a supplemental budget. But I think that category is there. They're throwing $1 billion plus at that for front-facing employees and people throughout the last 2 years. And I certainly would hope cops would be a separate line item, not just lumped under, because they didn't have a public safety thing. So I'm a little concerned that we are once again ignoring those people that were out there from day one, knocking on people's doors, responding to events, and so on. And then, along with my colleague, Commissioner Flynn, I am also announcing this is my last year on the board. After 20 years, I'm sure there are people out there that are ecstatic that I'm leaving. But honestly, it has been, as Matt said, an incredibly rewarding, an honor, a privilege, and one of the highlights of my life to serve this county. And what has made it even more easy and rewarding is the dedication and quality of the staff, the innovation and the awards that this county has been privy to over the last 20 years is truly extraordinary. And you saw another example of it today with refunding, saving $2 million that will not hit the property tax levies in the next several years. Do that a lot, do it all the time. So, if anybody's interested, I would love to entertain or talk to or meet with, have coffee. Anybody that might be interested, think they could be interested, throw their hat in the ring. The water's fine. It's been a terrific run. I have enjoyed almost every minute of it. And I'm sure there's a couple of 5-minute sections here and there that may have proved a little more taxing, but it has been a delightful existence, and I love this county and the people that work here. So that's it, along with Matt. I figure 20 years is probably enough at my age. You know, who knows how quickly senility will set in, right? Thank you.
No comment.
Thank you, Ken. We're all lucky to have you as a county commissioner. All right, I have no report, so I will leave you with just a short quote by George Bernard Shaw. 2 things define you: your patience when you have nothing, and your attitude when you have everything. So,
Adjourn.
Second.
all in favor?